This series of lectures is on reproductive pharmacology. So reproductive pharmacology is that branch of pharmacology that deals with drugs that principally affects fertility and sexual function. And it's a branch of system pharmacology we've already covered other areas in systems pharmacology, for example, cardiovascular system pharmacology, renal system pharmacology, GIT pharmacology, respiratory pharmacology, endocrine pharmacology, among others. And reproductive system pharmacology overlaps quite a bit with the endocrine system pharmacology because a number of drugs that we look at also have impact on hormones that are produced by the ovaries and the testes, as well as the hypothalamus and the pituitary gland. So there's quite a bit of overlap there, and we'll see some of the commonalities. In this first lecture, we'll review female reproductive anatomy and physiology. In the next lecture, we look at estrogen and anti-estrogens, followed by progestins and antiprogestins, then drugs used in hormonal contraception. We'll then turn our attention to the males and look at the male reproductive anatomy and physiology, androgens and anabolic steroids. Then we focus on gonadotropins and analogs, and eventually erectile dysfunction. So just to review female reproductive anatomy and physiology for those who may have forgotten, because this forms the basis of the understanding of the drugs that we're going to look at. The female reproductive system consists of two parts mainly, the internal and the external genitalia. The external genitalia is called the vulva, which consists of the clitoris and the labia. And then on the sagittal section, what we have, which is better shown in the next slide, we have the internal genitalia. The internal genitalia consists of the uterus. I don't know if you can see the cursor. The uterus is a pear-shaped organ, which consists of the top part here, the apex, which is called the fundus. Then you have the body or the corpus, and then the cervix. You also have the vagina. If you look at the uterus, it has, histologically, it has three sections. The outer layer of the uterus is called the perimetrium. The inner layer is called the myometrium. The middle layer, which is the muscular layer, and which is really the bigger component of the uterus, and the mucosal layer, which is called the endometrium. I hope you can see the cursor there. The endometrium has also two layers, the stratum basalis and the stratum functionalis. And then the most important organs of the female reproductive system are the ovaries. There are a pair of them. There are two ovaries, commonly described as almond-shaped, and the ovaries perform two principal functions. One is the production of the ova, which is called folliculogenesis or gametogenesis, and the other function is steroidogenesis, which is the production of various hormones, the estrogens and the progesterone. Now, if you look at the ovary there, we look at a bit in detail what happens during the menstrual cycle, but within the ovaries, you have growing follicles. So you have primordial follicles, primary follicles, secondary follicles, and eventually a Graafian follicle, which is not indicated there. Let's look at a bit more what happens during the menstrual cycle. The menstrual cycle may be described as a series of cyclical changes that happen during the reproductive period of the female, whose most obvious manifestation are episodes of bleeding, also called menstrual flow. And the menstrual cycle can be best described in looking at various cycles. There's one called the ovarian cycle. There's a cycle that happens within the ovaries, and the endometrial cycle that happens within the uterus. So it's the endometrial cycle or the uterine cycle. Let's look at a bit more detail on what happens during the menstrual cycle. So the menstrual cycle typically begins in puberty, that is around 12 to 14 years. And at puberty, there is production, the pituitary gland and also the hypothalamus increase their production of hormones. At the hypothalamus, the production of the gonadotropin releasing hormone that then stimulates the pituitary gland to produce FSH, follicle stimulating hormone, and luteinizing hormone. We'll look at that a little bit later on how that happens. But the beginning of that menstrual cycle, the first one is called menarche, and I've said it happens around age 12 to 14. It does vary depending on many things, the genetic background of the person, or perhaps even the nutritional status. So if you look at this diagram, which has segregated the menstrual cycle into endometrial cycle, here also written uterine cycle, and also the ovarian cycle, which is up there. I hope you can see the cursor. So the menstrual cycle typically takes 28 days. It's a cycle, so it has no really beginning or end, but conventionally, the first day of the menstrual flow is assigned as day 1. So we have there day 1, that marks the beginning, and the last day is day 28. These days vary, so can be a variation, say from 21 to 35 days. So it doesn't have to be exactly 28 days. If you look at what happens in the endometrium, or the uterus or endometrium during the menstrual cycle, we can divide what happens in the endometrium in 3 phases. One is the proliferative phase, if you can see my cursor there, which happens from around day 6 to day 14. And during that phase, there is proliferation of the endometrium due to the presence of estrogen. You can see, if you look here above, in terms of the ovarian hormones, you see an increase in the levels of estrogen, and estrogen is produced by the ovarian follicles, which causes proliferation of the endometrium. In the next phase is what's called the secretory phase, and secretory phase follows ovulation. Ovulation usually happens on day 14. You can see there on day 14. And the secretory phase is characterized by the presence of both estrogen and progesterone. Progesterone is produced by the corpus luteum. You can see up there. We'll look at the ovarian phase in a moment. And the uterus, the progesterone and estrogen acting together causes further growth of the endometrium, and there's also further the storage of glycogen, and there's further growth of various arterioles within the endometrium. You can see in the diagram those arteries, which are called spiral artery due to their shape. And if there's no implantation, say at day 28, the ischemic phase, which is also called the menstrual phase, will follow. And this is characterized by the shedding off of the stratum functionalis of the endometrium. It is thought that this happens due to increased action of the prostaglandin F2 alpha, because during this time, there's very low levels of progesterone during the ischemic phase. And progesterone is thought to antagonize the action of prostaglandin F2 alpha. So the other The other cycle, as we said, is the ovarian cycle. So you can see here, ovarian cycle has two phases, follicular phase, then you have ovulation, and the luteal phase. The follicular phase is just like its name says, is characterized by the development of ovarian follicles. So just like I showed you, in the ovaries, you have primary follicles. So in the beginning, you have primary follicles, and under the effect of follicle stimulating hormone, these follicles develop, grow, they have a fluid-filled antrum, so you can see there in the middle, the one I'm pointing at, and they therefore become secondary follicles. One of the secondary follicles, one of them become a mature follicle called the Graafian follicle, which under the impact of luteinizing hormone, which you see they are picking there on day 14, will mature and release an ovum in the process called ovulation. And so that marks then the end of the follicular phase. So the ovaries are in follicular phase from day 1 to day 14. Thereafter, after ovulation, the ovary are in the luteal phase. It's called the luteal phase. Luteal really comes from the corpus luteum, which is what the Graafian follicle becomes. And luteum meaning yellow, so it is the yellow phase, so the luteal phase. So during the luteal phase, you have the ovary, the corpus luteum produces a lot of progesterone, and that then is the description of the ovarian cycle. So you can see that the follicular phase of the ovarian cycle corresponds to both the menstrual phase or the ischemic phase of the endometrial cycle, as well as the proliferative phase, while the luteal phase corresponds to the secretory phase of the endometrial cycle. Now, this diagram just shows the way the histology of the stratum functionalis at the various phases. So during the proliferative phase, the secretory phase, and during the ischemic phase. Now, let's look at perhaps the regulation of the menstrual cycle. The menstrual cycle is regulated by the hypothalamic pituitary gonadal axis. So you have the hypothalamus that produces the hormone called gonadotropin releasing hormone. This hormone is released in the portal circulation and reaches the anterior pituitary, and the anterior pituitary or adenohypophysis produces two important hormones, follicle stimulating hormone and luteinizing hormone. These hormones are then transported to the ovary, where FSH will cause the growth of the ovarian follicles. LH has important role, as we've seen before, on the further development of the Graafian follicles and at ovulation. So let's look at what happens at the beginning of the cycle in terms of its regulation. So the main scheme in regulating the menstrual cycle is via negative feedback mechanism. That is, the hypothalamus produces gonadotropin releasing hormone, which then acts on the anterior pituitary to produce FSH and LH, which then eventually also acts in the ovary to increase the secretion of estrogens. Then estrogens, the high levels of estrogen, suppress both the anterior pituitary as well as the hypothalamus, so that you have a negative feedback mechanism. So if you look at this diagram at the beginning of the menstrual cycle, you'll see that you have initially low levels of estrogen. I don't know if you can see that there, or in the previous diagram. We'll also look at it in the next one. And the low levels of estrogen when there are low levels of estrogen, you have high secretion of FSH, which then stimulates the growth of the follicles. However, towards the end, in the late follicular phase, in 1 to 2 days before day 14, which is the day of ovulation, there's a high production of estrogen. And this high production of estrogen, instead of suppressing the production of gonadotropin releasing hormone, actually stimulates. So you have a positive feedback effect. So prior to ovulation, instead of having, like in the early follicular phase, in the late follicular phase, you have regulation through a positive feedback mechanism. So high estrogen will result in stimulation of the hypothalamus that produces GnRH and LH. This increase in the levels of LH, you can see that there's a high level of LH there in red, the curve in red, is called the LS surge. Okay, there's also a slightly elevated level of FSH, and this is usually called the FSH spike. The LH has a number of functions. One, it stimulates the maturation of the ova. So you have the completion of the first meiotic division, and that is the final step in the oocyte maturation. And it also stimulates the production of prostaglandins and proteolytic enzymes that are responsible for ovulation. So you have eventual extrusion of the ovum from the Graafian follicle. Next, then we have the luteal phase. In the luteal phase, then the regulation of the menstrual cycle reverts to negative feedback control. High levels of progesterone, for example, you can see in this curve, especially on day 21, there's a peaking of progesterone and also estrogen on day 21 of the menstrual cycle. These levels will suppress the hypothalamus and the anterior pituitary, and they will therefore be low levels of FSH and LH. So the low levels of FSH and the diminishing levels of progesterone, we have already indicated the effect of the diminishing level of the progesterone. The low levels of progesterone then will trigger menstrual flow because of ischemia of the endometrium. Equally, the low levels of progesterone will exert a negative feedback effect on the hypothalamus and the pituitary, and therefore you have increased production of FSH, and FSH then has an impact on the follicular phase, on the growth of the follicles, and therefore the cycle begins. So basically, we've seen in this lecture the anatomy and the physiology of the female reproductive system. We have also looked at the regulation of the menstrual cycle in terms of the phases, the phases of the menstrual cycle, and the regulation by the hypothalamic pituitary gonadal axis. So that then will bring us to the end of this session.